If fruits could clean your arteries, India would not be facing such a high burden of heart diseases and strokes. Today, cardiovascular diseases and strokes account for nearly 1 in 4 deaths in our country. Similarly, nearly 30% of brain strokes occur before the age of 50. What is even more concerning is that we are seeing heart attacks and artery blockages almost 10 years earlier compared to many Western populations. So, the real question is not which fruit is good for the heart or brain, but if fruits actually influence the biological process that leads to artery blockages, or is this just marketing? Today, let's look at what science and data actually tell us. Hello everyone, I am Dr. Santosh Patil. I am a neuro and vascular interventional radiologist, European board certified with over a decade of experience in treating stroke, blood clots, vascular problems and metabolic conditions that affect blood circulation. In my clinical experience, many vascular problems develop silently over years, and very often when patients finally come to us, they say, "Doctor, I wish I had understood this earlier." That is why conversations like this matter. Let's get started. First, we must understand something clearly. Arteries are not pipes. They are living tissues. They have layers. They respond to stress. They repair themselves. They adapt. When we talk about artery blockage, we are talking about a process called atherosclerosis. Now, let me explain that in simple terms. Atherosclerosis begins when the inner lining of your blood vessel, called the endothelium, it gets damaged. This damage can happen due to high LDL cholesterol, high blood pressure, smoking, blood sugar spikes, chronic inflammation. When LDL cholesterol enters the vessel wall and it becomes oxidized, meaning it chemically changes to inflammation, the body reacts. White blood cells enter the vessel wall, fatty deposits start building up, and over the years, this becomes plaque. That plaque narrows the artery, and when it ruptures suddenly, it causes a heart attack or brain stroke. Now, this process happens gradually in 10 to 20 years, which is why prevention is key. Now let's talk about specifically Indians. Research shows that South Asians have a unique metabolic profile. Compared to many Western populations, we have higher insulin resistance, higher triglycerides, lower HDL cholesterol, which is the protective cholesterol, greater tendency for abdominal fat, earlier endothelial dysfunction. Now, what does insulin resistance mean? It means your body does not respond to insulin efficiently. So, your blood sugar rises more easily, and repeated sugar spikes, they damage the endothelial lining of the blood vessels. Even individuals who appear physically fit can have what we call metabolically obese normal weight. This means they look normal externally, but internally they carry higher cardiometabolic risk. Data from ICMR and the India State Level Disease Burden Initiative shows that cardiovascular disease burden has doubled in the last 25 years. And importantly, risk factors are appearing in people in their 30s and 40s. And that means prevention has to begin way before. Now, multiple large studies have shown that higher fruit and vegetable intake is associated with a 20 to 30% reduction in long-term cardiovascular risk. A major meta-analysis published in the journal Circulation showed that people consuming 5 servings of fruits and vegetables daily, they had significantly lower mortality from heart disease and brain strokes. This is not about one magic fruit. This is about biological influence over time. Let's see how. So, fruits contain fiber, polyphenols, flavonoids, vitamin C, potassium, and natural antioxidants. Now let us break down each one. Fiber. Fiber reduces cholesterol absorption from the intestine. It also slows down the glucose absorption. Now this prevents sudden sugar spikes. Polyphenols. These are powerful plant compounds. Your body cannot produce them. They reduce oxidative stress, meaning they reduce the chemical damage that leads to LDL oxidation. Then comes the flavonoids. Now these improve nitric oxide production. Nitric oxide helps the blood vessels to relax and stay flexible. Vitamin C. Vitamin C supports collagen production. Collagen gives strength and elasticity to the vessel walls. Potassium. It helps regulate the blood pressure. So, fruits do not clean arteries like a brush, but they influence the processes that decide whether plaque builds up quickly or slowly. And that is the real science. Now, let's talk about some commonly discussed fruits. Pomegranate. Pomegranates are rich in antioxidants called as punicalagins. It is difficult to pronounce, but small clinical studies show this difficult to pronounce antioxidant has helped show improvement in the carotid artery, that is the artery supplying blood to the brain. Next, berries. We love our berries. Strawberry, raspberry, mulberry, or the highly nutritious blueberry. Berries are high in anthocyanins, which is associated with improved vascular relaxation and modest LDL reduction. Next is citrus fruits like orange, lemon, lime, grapefruit. All these fruits are rich in vitamin C and flavonoids. And in turn, consuming these fruits, it helps support the endothelial health and reduce the oxidative stress. Apples. They say an apple a day keeps the doctor away. Now that is absolutely right. Apples contain pectin, a soluble fiber, and studies show that LDL reduction happens with regular consumption of apples. Then we come to our Indian fruits like amla, guava, jamun. Amla has shown improvement in lipid profile and inflammatory markers in small trials. Guava improves the HDL and provides excellent fibers. Jamun, it helps with glycemic control, which is extremely relevant for insulin-resistant individuals. For Indians, managing sugar spikes is as important as managing cholesterol. And this is where eating whole fruits comes to the rescue. However, we do not advise fruit juices at all, as they do not offer the same metabolic advantage like raw fruits. Now, how should you consume your fruits? Well, the form matters. As a medical professional, I would always suggest consuming the whole fruit. And when you eat the whole fruit, fiber remains intact, sugar absorption is slower, and insulin response is smoother. Smoothies are acceptable only if the fiber is not rich. On the other hand, we do not advocate for fruit juices as juice removes the fibers of the fruit. Needless to say, packaged fruit drinks often contain added sugar as their main component. So friends, the simple rule is whole fruit is better than juice. Consistency is more important than quantity. The World Health Organization recommends at least 400 grams of fruits and vegetables daily, and remember that small daily habits they compound over years. On the other hand, I also want to set a realistic expectation and clarify something important. If someone already has severe blockages in the arteries, fruits alone are not a treatment. Fruits are a fantastic source for prevention, slowing the progression, improving metabolic profile, and reducing inflammation from a scientific standpoint of view. So can fruits clean your blood vessels? So they don't scrub plaque away like a pipe cleaner, but they influence the biology of your arteries in powerful ways. They reduce the oxidative stress, they support the endothelial health, they improve the metabolic balance, and in a country where heart diseases and strokes are appearing earlier than ever, our daily dietary decisions are more important than ever. If this information helped you understand your vascular health better, share it with someone in their 30s or 40s to increase the awareness.